If you're over 60, there's a truth that very few people say out loud. Your legs may already be losing healthy blood circulation right now, and you might not even realize it. That heavy feeling when you walk, a mild tingling in your feet, or needing to stop and rest sooner than you used to, most people assume these are just signs of aging. But from a medical perspective, it's not that simple. These could be early signs of declining peripheral circulation. The problem is, this process happens quietly. Blood vessels don't become impaired overnight. Instead, inflammation builds up gradually over time. Vessel walls lose their elasticity, their ability to expand decreases, and the amount of oxygen reaching your muscles starts to drop. By the time you begin to notice symptoms, these internal changes may have already been developing for years. But here's something important that most people are rarely told clearly. There are natural compounds found in certain oils that have been clinically studied and shown to support vascular function, boost nitric oxide production, and improve blood flow. Even more interesting, when used correctly at the right time, some of these oils can work together synergistically, creating a much stronger effect than when used on their own. In this video, I'll share 5 science-backed oils that may help improve circulation in your legs, starting with the most basic one, which is often the most overlooked. Before we go any deeper, take a few seconds to listen to your own body. Have you ever felt dizzy when standing up too quickly? Do your feet often feel cold even when the weather isn't? Or by the end of the day, do your legs feel heavier and more fatigued than usual? These signs are not minor. In clinical practice, they're often early signals that your blood circulation isn't working as efficiently as it should, especially in the legs. The concerning part is that these symptoms develop very gradually. You get used to them and start to believe they're just a normal part of aging. But in reality, this is your body trying to warn you. So here's something simple I want you to do right now. Leave a one-word comment below. Dizzy, cold feet, or heavy legs. The word you choose doesn't just help you recognize your own condition, it also helps me better understand your situation so I can share more relevant content with you in future videos. Because improving circulation doesn't start with medication. It starts with understanding your body's signals. Poor circulation doesn't start with symptoms. It begins with very subtle changes at the cellular level that you can't see. Inside your blood vessels is a thin layer of cells called the endothelium. This layer plays a critical role in regulating blood flow. It produces a substance known as nitric oxide, a molecule that helps blood vessels relax and widen, allowing blood to move more easily. But over time, especially after the age of 60, the body begins to change. First, low-grade chronic inflammation increases. This damages the endothelium and reduces its ability to produce nitric oxide. Second, bad cholesterol, LDL, becomes oxidized and starts to stick to the vessel walls, forming plaque buildup. Third, the smooth muscles in the vessel walls gradually lose their elasticity, making it harder for blood vessels to respond properly to signals that tell them to expand. So what's the result? Blood vessels become narrower, stiffer, and less responsive, and blood flow slows down, especially in smaller vessels like those in the legs and feet. That's why you may begin to notice heaviness in your legs when walking, cold feet even in warm weather, nighttime leg cramps, leg fatigue even without much activity. Understanding this mechanism is the first step, because once you know where the problem lies, you can start taking the right actions to improve it. In medicine, reduced blood flow to the legs is known as peripheral artery disease, PAD. This is not a rare condition. In fact, in the United States, more than 8 million people over the age of 60 are living with PAD, yet many of them don't even realize it. The reason is simple. PAD develops very quietly. Blood vessels don't suddenly become blocked. They gradually narrow over time due to inflammation, plaque buildup, and reduced ability to expand. By the time symptoms appear, the process may have already been progressing for years. Common signs include pain or fatigue in the legs when walking, especially over longer distances, numbness or weakness in the legs, feet that feel colder than usual, slow healing wounds on the feet or lower legs. What's important to understand is that PAD doesn't just affect your ability to walk, it's also closely linked to a higher risk of serious cardiovascular conditions, including heart attack and stroke. That's why early recognition and timely intervention are so important, not just to reduce symptoms, but to protect your long-term overall health. Olive oil is often seen simply as a healthy fat, but from a medical perspective, its role in vascular health goes much deeper. The primary component of olive oil is oleic acid, a monounsaturated fat that helps reduce the oxidation of LDL bad cholesterol. When LDL becomes oxidized, it's more likely to stick to artery walls and contribute to plaque formation. Even more importantly, extra virgin olive oil contains powerful bioactive compounds called polyphenols, especially hydroxytyrosol and oleocanthal. These compounds have been shown to stimulate the body's production of nitric oxide, which helps blood vessels relax and improve circulation. Large-scale research, including the Predimed trial, has found that regular use of high-quality olive oil is associated with a reduced risk of cardiovascular disease and better vascular function. However, the benefits depend on how you use it. Choose extra virgin, cold-pressed, unrefined. Use it raw, not for high-heat cooking. Aim for about 2 tablespoons per day. One small but important detail. High-quality olive oil often has a slightly peppery or throat-tingling sensation that's a sign of active polyphenols working in your favor. To understand why these oils can improve circulation, you need to understand one core factor in your vascular system: nitric oxide. Nitric oxide is a signaling molecule produced by the endothelium, the thin inner lining of your blood vessels. Its main job is to send signals to the smooth muscles in the vessel walls, helping them relax and widen, a process called vasodilation. When blood vessels widen, circulation improves. Blood flows more easily, pressure on the heart is reduced, and more oxygen reaches your tissues, especially in areas like the legs and feet. But over time, your body's ability to produce nitric oxide begins to decline. After the age of 60, many people start to experience reduced elasticity in blood vessels, a tendency toward higher blood pressure, decreased blood flow to the extremities. This isn't just due to aging, it's also linked to chronic inflammation, oxidative stress, and lifestyle factors. When nitric oxide levels drop, blood vessels become narrower and stiffer. As a result, blood flow slows down, leading to symptoms like cold feet, tingling, or leg fatigue even during light activity. That's why many modern studies focus on enhancing the body's natural production of nitric oxide through nutrition, especially with oils rich in polyphenols and omega-3s. Simply put, when nitric oxide is working well, your blood vessels open up and circulation improves significantly. If olive oil supports vasodilation through nitric oxide, then fish oil omega-3 acts more like an anti-inflammatory engine for your vascular system. The two most important components in fish oil are EPA and DHA. These omega-3 fatty acids have been extensively studied in cardiovascular health. Unlike olive oil omega-3s don't act immediately on vessel dilation. Instead, they target chronic inflammation, which is a root cause of damage to the vessel walls. Specifically, omega-3s help to reduce the production of inflammatory cytokines, decrease platelet aggregation, lowering the risk of small blood clots, improve the flexibility of red blood cells, allowing blood to flow more easily through tiny capillaries. Some clinical studies, such as the Omega-PAD trial, have shown that fish oil supplementation can improve endothelial function, meaning better responsiveness and expansion of blood vessels in people with circulation issues. This is especially important for older adults, where low-grade inflammation can quietly persist in the blood vessels for years without obvious symptoms. In simple terms, fish oil doesn't just help clean up the internal environment of your blood vessels, it also helps your blood flow more smoothly and consistently over time. One of the most fascinating insights in nutritional medicine is this: certain nutrients can work far more powerfully when combined than when used alone. And olive oil and fish oil are a classic example. These two oils work through different but highly complementary mechanisms. Olive oil helps boost the production of nitric oxide, promoting vasodilation, widening of blood vessels. Fish oil helps reduce inflammation and protect the vessel walls. When combined, you're not just opening the blood vessels, you're also cleaning up the internal environment of those vessels, creating ideal conditions for smoother, more efficient blood flow. Research on the Mediterranean diet has shown that combining these healthy fats can produce stronger anti-inflammatory and vascular protective effects than using each one individually. A simple way to apply this: morning, 1 tablespoon of extra virgin olive oil, along with about 1 gram of fish oil from supplements or fatty fish like salmon. This small routine can create a synergistic effect, supporting both vessel function and overall circulation over time. Morning timing matters because this is when your body begins its active cycle and your circulatory system needs to be switched on efficiently. Put simply, when you combine the right nutrients at the right time, you create a kind of synergistic effect, helping your blood vessels function better from the very start of the day rather than supporting just one aspect in isolation. Another oil worth paying attention to is Nigella sativa, also known as black seed oil. While it's not widely known in Western countries, it has been used for thousands of years in traditional medicine across the Middle East and South Asia. Its main active compound is thymoquinone, a bioactive substance with powerful effects on the vascular system through multiple mechanisms. First, thymoquinone helps reduce inflammatory cytokines, the key drivers behind damage to vessel walls and plaque formation. Second, it supports the activity of enzymes involved in producing nitric oxide, helping blood vessels relax and improving circulation. Third, it reduces platelet aggregation, lowering the risk of small clots that can block microcirculation. Some clinical studies have shown that supplementing with black seed oil may improve endothelial function, meaning better ability of blood vessels to expand when blood flow increases. Typical recommended intake: around 500 milligrams to 1 gram per day, either in capsule form or as pure oil. While it's less commonly used, this is a promising option if you're looking to support circulation more comprehensively, targeting inflammation, vessel flexibility, and blood flow all at once. Not just limited to traditional use, Nigella sativa has now been studied in multiple modern clinical trials, and the results show quite clear effects on the vascular system. In one randomized controlled trial involving adults at cardiovascular risk, taking about 500 milligrams of black seed oil daily for 8 weeks led to a significant improvement in endothelial function measured by flow-mediated dilation, FMD. This is considered one of the gold standards for assessing vascular health. The results showed that blood vessels in the group using black seed oil were able to dilate more effectively compared to the placebo group. At the same time, levels of nitric oxide in the blood increased noticeably, indicating improved vessel relaxation. In addition, meta-analyses combining data from multiple studies have found that black seed oil can reduce inflammatory markers in the blood vessels, such as ICAM and VCAM, key indicators of inflammation and endothelial dysfunction. This is particularly important because chronic inflammation is one of the main drivers of long-term damage to the vessel walls. In summary, Nigella sativa is not just a natural remedy, it also has a solid scientific foundation, especially in improving vasodilation, reducing inflammation, and supporting blood circulation in older adults. Unlike the previous oils that are taken orally, castor oil works through a completely different mechanism, acting directly from the outside on the legs. The main component of castor oil is ricinoleic acid, a fatty acid capable of penetrating deeply through the skin. When applied to the calves and feet, it may help stimulate local blood circulation, support lymphatic drainage, and reduce localized inflammation. Some studies suggest that topical use of castor oil can improve microcirculation, the network of tiny capillaries just beneath the skin. This is often the first area affected when circulation begins to decline, especially in older adults. In addition, local stimulation of nitric oxide has also been observed, helping small blood vessels relax and increasing blood flow to the applied area. One notable advantage is that the effects of castor oil can often be felt relatively quickly. Many people report a warming sensation in their legs and reduced heaviness within 20-30 minutes of use. Simply put, while oral oils help improve circulation from the inside, castor oil acts as a targeted therapy, supporting the exact area where you feel symptoms most clearly. To get the most benefit from castor oil for circulation, how you use it matters just as much as the oil itself. It's not just about applying it, but applying it correctly. First, gently warm about 1-2 tablespoons of castor oil in your hands. A slightly warm temperature helps improve absorption into the skin and underlying tissues. Next, apply it starting from your feet and move upward toward your knees, always in an upward direction. This is very important because the veins in your legs contain one-way valves that help return blood to the heart. Massaging upward supports this natural flow and helps prevent blood from pooling in the lower legs. Use slow, steady motions with moderate pressure for about 3 to 5 minutes per leg. You don't need to press too hard, but it should be enough to create a warming sensation and stimulate circulation. The best time to do this is in the evening before bed. At that point, your body is in a more relaxed state, allowing the oil to absorb and work more effectively. One small tip: castor oil is quite thick and can feel sticky, so you may want to wear a thin pair of socks afterward to avoid staining your bed sheets. When used correctly, many people notice a clear difference after just a few applications. In this list, flaxseed oil is often considered one of the fastest acting options for improving circulation, especially in older adults dealing with heavy legs, cold feet, or poor blood flow. What makes flaxseed oil stand out is its very high content of ALA, alpha-linolenic acid, a plant-based omega-3 fatty acid. Once in the body, ALA can be partially converted into EPA and DHA, two key compounds that support cardiovascular health. But perhaps the most notable benefit is its ability to reduce blood viscosity. When blood becomes too thick, the heart has to work harder to push it through already narrowed vessels. In contrast, when blood is more fluid and flexible, it can move more easily even through the smallest capillaries in the legs. In addition, flaxseed oil may help reduce inflammatory markers in the body, lower fibrinogen, a protein linked to blood clotting and thickness, improve endothelial function. Some studies suggest that after just a few weeks of consistent use, people with circulation issues begin to notice improvements in peripheral blood flow. Recommended use: about 1 tablespoon per day, taken directly or mixed into yogurt, smoothies, or salads. This makes it an excellent choice if you're looking for relatively quick and noticeable results. Now that you understand each type of oil and how they work, the most important part is how you combine and apply them in your daily routine. You don't need to use everything all at once, but if you want to optimize the benefits in a science-based way, here's a simple protocol you can follow. Morning, activate circulation. 1 tablespoon of olive oil, taken directly with breakfast, combined with about 1 g of fish oil from capsules or fatty fish like salmon. This combination helps increase nitric oxide production while reducing inflammation, creating a strong foundation for healthy blood flow throughout the day. During the day, improve flow dynamics. 1 tablespoon of flaxseed oil. Use cold, do not heat. 500 milligrams of Nigella sativa. This pair helps reduce blood viscosity and supports vessel relaxation, improving blood flow to the legs. Evening, targeted support. Massage castor oil onto your legs for 5-10 minutes before bed. This step works directly on the area where symptoms are most noticeable, helping stimulate local circulation and reduce heaviness. This helps improve local circulation and reduce that heavy leg feeling at the end of the day. The most important principle: consistency. A small change done every day will always be more effective than trying many different methods without sticking to any of them. Start simple and let your body respond over time. At this point, you've likely realized something important. Poor circulation is not an inevitable part of aging. It's the result of changes happening inside your blood vessels, and it can be improved when you address it the right way. You don't need to change everything overnight. In medicine, sustainable progress always begins with small, targeted steps. Maybe today, all you do is add 1 tablespoon of olive oil to your breakfast, or try a simple leg massage with castor oil before bed. But if you do it consistently, your body will start to respond. So if you're truly serious about your health, leave a one-word comment. It's not just a comment, it's a commitment to your own body. And if you found this helpful, share this video with someone you care about, especially those dealing with heavy legs, cold feet, or difficulty walking. Sometimes the right information at the right time can help someone avoid much bigger problems in the future. Start today.